Okay, we're continuing with this book here, Prevent and Reverse Dental Disease by me, Pete Rogers. We're on page 18. Okay, so we talked about the anatomy of the tooth, and we talked about what cavities look like, what cavity fillings look like, but now we got to go into more detail to understand how do you prevent cavities. And so the secret of preventing cavities is understanding what I'm going to teach you right now, the hydrodynamic theory. So the top of the tooth is the crown, the enamel, that's the white part you can see in the mirror. The middle part's called the dentin or dentine, either one, and it's got these tubules that extend outward. They go from outside the tooth to the pulp space, the root canal. They're important because bacteria from the mouth can travel through these tubules, okay? And what makes the tooth alive is that the artery comes in, the vein goes out, the nerve comes in and exits. There's exiting and entering nerves. And that's why this pulp space has to be intact for the tooth to be alive, all right? And I'm going to explain. Normally what happens is fluid leaks out at the capillary and that it's under pressure, hydrodynamic pressure from the heartbeat, and that pushes fluid out of these dentine tubules. So it keeps the fluid going outward, and that helps to push bacteria out of those tubules. And that's what you want. If you block these arteries because they're vasoconstricted because you're stressed out and they're clamped down because the catecholamines are causing vasoconstriction, if you eat a high salt diet, you're going to vasoconstrict to there. If you have atherosclerosis, you're going to occlude the blood flow going in. As people get older, they get more and more occlusions. I look at a lot of CAT scans of the brain, and especially the worst are kidney failure patients, but people have extensive calcifications from atherosclerosis in their external carotid arteries that go to the face, go to the jaw. You're going to have poor blood supply, and I can tell you this. I look at tons and tons of CAT scans of the brain for cognitive decline, memory loss, demented patients, and most of them have terrible teeth. Most of them have no teeth or a bunch of tooth problems, periapical lucencies from periapical bone abscesses. I see that all day long, every day. And so what I'm trying to say is lack of blood supply to the brain goes hand in hand with lack of blood supply to the mouth, and if you don't have good blood flow coming into these teeth, then you can't push that fluid out, you can't push the bacteria out. The bacteria come in and they destroy the tooth. Okay. This is really important, hydrodynamic theory. I'll show you another picture of it. Okay, so here's more detail. So this is showing you the direction of the flow. Arterial flow comes in at the capillary, some fluid leaks out, and that fluid is hydrodynamically pushed out of these tubules. And that pushes the bacteria. You want to keep pushing those bacteria out of the tubules so they don't, take up residence and destroy the pulp space. All right? That's important to know. So you always want good blood flow. That's why you always want good flow. Every single thing in your body does better with good blood flow. What gives you good blood flow? Low fat, low sodium, 100% vegan diet with no oil and none of this high fat crap like nuts and seeds and none of that stuff, okay? If you want to optimize things, okay? And most people are fighting their way out of a problem because they've eaten the standard American diet or some bogus high fat Mediterranean diet in the past, and they've got atherosclerosis at a baseline, and they want to try to minimize that, stop it from progressing, try to reverse it. Okay. So there it is, the hydrodynamic theory of healthy teeth. Okay. When you're stressed out, you get vasoconstriction, or if you're sleep deprived, all of those things are going to drop blood flow to the tooth. So psychological stress increases catecholamines. Same thing with caffeine, increases catecholamines. Caffeine is not good for you. Coffee is not good for you. That's all BS, okay? Any billion-dollar food gets a bunch of fake advertising, just so you know, and I don't think tea is good for you either. It's all advertising BS. It's high in fluoride. It's often high in other toxic things like aluminum. So, yeah, as people get older, most of them got hypertension and diabetes. They start plugging up these arteries. Then they don't have good blood flow into the tooth. They can't keep the bacteria out. The bacteria come in. They grow. They produce acid. The acid erodes the tooth, and they destroy the tooth. Most cognitive decline and demented people, they have terrible teeth. I went to a dentist because I reactivated a cavity, and he's like, oh, wow, you're taking such good care of your teeth. Good for you. Yeah, so hopefully that's why my brain still works. Okay. All right, so let's talk about, besides stress and vasoconstriction, what else is bad for cavities? If you drop saliva production, then the mouth dries out. Your saliva is the greatest thing for protecting you from cavities. It's got antimicrobial properties that protect you from cavities. It's got a good pH on it, heading towards the basic side of things. That protects your teeth because the acid erodes the enamel. So if you're stressed out, you'll have less saliva. A lot of medications will drop saliva. A lot of like antidepressants will drop saliva, and that can lead you having cavities. Anything with those anticholinergic effects will drop saliva, can give you cavities. You have less saliva made at night while you're asleep. That's why you want to clean your teeth real good before you go to bed. You want to floss them with an old-fashioned cheap floss. Don't use the modern ones because they got Teflon on them. That's bad for you. Just get the old-fashioned cheap crappy floss. Yeah, it breaks more often, but it's still good. I brush my teeth with no toothpaste just to get the biofilm off the teeth because that's where the bacteria can live to get them to stick to your teeth. They can't cause a cavity if they're not sticking to your tooth. So it's good to brush them at least once a day. I do it at night. It would be a good thing probably to brush them in the morning too, but with no toothpaste. You don't need toothpaste. Toothpaste I think is bogus. Okay, let's see. I give a whole lecture about tooth care and toothpaste and stuff over at VegSource if you want to see that. Anything that decreases saliva is bad for the tooth. Anything acidic is bad for the tooth, so you don't want soda pop, real acidic, and it's sweet, and it's sticky. It sticks to the tooth with acid. Bad, bad, bad. Orange juice is bad too. Orange juice is really acidic. Lemon juice, really acidic. You don't want those things. They'll increase your risk of cavities. Okay. You don't want to grind your teeth. They can wear down the enamel, increase your risk of cavities. What else causes cavities? Again, a cavity is produced by bacteria that's sticking to the tooth, digesting a sugar, and then its waste product, lactic acid, it puts that acid on the tooth, and then that acid burns a hole in the tooth. Okay, that's a cavity. Let's see, what else? And yeah, after I did not like, I had to have a couple cavities filled, and I hated it, so I became pretty careful after that. I went through one stupidity phase where I tried the sugar diet of Mark Bell and his other crazy friend, and I regret that I tried it because it reactivated a cavity, but I got it under control once I got all the sugar out of my diet. That's the reason why I don't like these simple sugars. For a lot of people, it'll just rot your teeth. Some people get away with it, but a lot of people don't. Anything that tastes real sweet, I won't eat it. I'll never add sugar to my food. I'll never eat processed food. Unless I'm starving, I would never do that. Also because the MSG is toxic, okay? I only eat single ingredient whole foods. Let's see. I'll eat some foods with minimal processing, like white rice is minimally processed. I'll eat single ingredient oatmeal with water and maybe throw fruit on there. I don't do anything that'll suppress immune function. How do I clean my teeth? Well, what I do at night is, first of all, I rinse my mouth with water after eating. Then I will floss with the cheap old floss with no slippery stuff on it, because that's usually going to be Teflon. Then I will brush my teeth just to get any biofilm off of there. Then I'll rinse again with water, and then I'll go to bed. I used to use water pick, but I stopped doing that just because I worried. A viewer sent me a comment that they think that it has microplastics, and I don't know for sure if it does or not, but I would bet you it does, just because it goes through plastic tubing, it sits in a plastic container, and it's pushed under high pressure. So I wrote this right before I made that decision not to use water pick anymore. Let's see, and use a soft toothbrush. The harder toothbrush can erode your teeth. All the toothpaste seem toxic. People say, well, why don't you use a toothpaste? Because I think they're all full of toxic chemicals. Artificial sweeteners like stevia and aspartame. Aspartame is a neurotoxin. Stevia lowers your fertility, causes other problems for you. Artificial dyes can be mitochondria inhibitors, cause hyperactivity, ADHD in kids. Some of these other things, I don't even know quite what they are, but they're cytotoxic. I looked them up. Carrageenan's excitotoxic. It also can increase risk of leaky gut, can contain MSG. It's bad, bad, bad. I one time spoke to a researcher who had done a lot of research on it. She told me it's real bad, stay away from it. Diethanolamine, foaming agent, hormone disruptor, bad. These are all the things in toothpaste. They're all bad. Fluoride's a major toxin. It's rat poison. It's bad for you. It's total crap. We shouldn't. Heavy metal toxins. Lead Safe Mama tested 51 brands of toothpaste. Look at these results. 9 out of 10 were positive for lead. 2/3 positive for arsenic. Half of them positive for mercury. 1/3 positive for cadmium. They're terrible. They're full of poison. Okay, that's why toothpaste makers can kiss my ass. I don't intend to ever use toothpaste again. I haven't noticed any problem since I stopped using it. It's kind of like shampoo. Stop using it. Makes no difference. I don't use it anymore. There's one less chemical thing I can avoid. Now, Lead Safe Mama, who is she? She's a lady. TamaraRubin.com is her YouTube channel, her website. Her kids got lead poison. She's pissed off, and she started testing all these things. She's not a scholar of health or of nutrition. She's kind of fat, but she was pissed off and she wanted to do something to sort of, in response to the suffering of her family with the lead poisoning. So I think what she does is good. She provides a good service, okay, I don't know how exact and precise her stuff is, but so far it's been reasonable that I've seen it and correlates reasonably well from what I've seen so far. I don't know though. I haven't gone through all her stuff. I can't tell you I know for sure she's legit. I can't tell you I know for sure she's not full of shit or promoting or selling anything, but I'm just not aware of it. And the few things that I've checked, she's been reasonable, so for what that's worth. There was a whole documentary about her and her experience, and she gave some talks over at that Silicon Valley Health Institute place. These are other things in toothpaste. Parabens, they're estrogenic, I don't want that. Propylene glycols like antifreeze, detergent, solvent can increase your risk of leaky gut. They use it in paints. I don't want anything to do with that. Antifreeze in your car. Sodium lauryl sulfate's a pesticide. I don't want that crap in my mouth. They use names to hide it like sodium dodecyl sulfate, monododecyl ester. They're similar enough. They're all bad. Titanium dioxide whitener toothpaste can cause inflammation of the bowel. Whiteners are all bad. Apparently they can oxidize and damage the tooth, according to the dentist who I was reading their papers on that. Triclosan's another pesticide toxic. So once you look at all the toxins in these toothpastes, you don't want to use them, all right? Like Joseph Heller said in his book, Catch-22, just because you're paranoid doesn't mean they're not out to get you. There's tons of crap in your water and your toothpaste and most of these corporate productions, okay? They think that, some people say, should you do it with salt or baking soda? I don't have experience doing that. Hydrogen peroxide, I don't have experience doing that. I did that once because I had a friend who was a dentist who told me to do that for gingivitis. Seemed to help a little bit. I don't know, that was like 40 years ago. So anyways, that's what I currently do. Hope you found that helpful.